Okay, so let's get to the case of the day. Let's go to Radiopedia and let's do some quiz. I'm not sure what is going to happen, but let's start a quiz. So let's start it. So we are getting a frontal and lateral X-ray of the skull. Let's see. So let's start from the frontal. You can see the sinuses, probably the maxillary. There is no lytic lesions of the skull. Maybe there is a little bit of deviated nasal septum, but I don't really care. Here are the area of the concha. The skull seems quite fine without any very uh, cannot see any shouting fractures. On the lateral view, again, here is the sphenoid sinus, the maxillary sinuses. Of course, the tooth without any something to tell you about abscess. Maybe here's some impacted molar tooth. Except for this, there is no cyst around it, no okay. Here is the hyoid bone. Here is the trachea. The atlas axis dense. Maybe there is something here. Okay, let's continue. I don't see anything that very. Let's see what's going on. Absence of mandible is noted. Oh gosh, that is quite true. There is no mandible right over here. What was the reduced movement of the jaw with dual arching pain associated with soft tissue swelling? Oh my god, I missed a total mandible. So where those tooth came from, if not from the mandible? Okay, from the gingiva and everything, but okay, there is no mandible. Which syndrome? It looks like a kid, maybe. Which syndrome? 5 years old. Which syndrome comes with no mandible and there is swelling? You can see the palate. You can see, of course, you can see the hard palate, the soft palate, but the tooth, but there is no mandible. Oh my god, I could have just missed a total mandible. Okay, but what is going on? Just swelling, reduced movement of the jaw with dull arching pain associated with soft tissue swelling. Maybe there is an abscess or something. I don't see any central hypodense area with a rim enhancement, but they didn't give contrast. Okay, so maybe there is an abscess right over here, because there is an area of hypodensity. Why didn't they give contrast? But there is an area of hypodensity, something, maybe something right over here. Maybe I even see some fat stranding around this. It's probably, this is the lesion. And you can see it right over here. So it's around the tooth. Maybe there is some tooth decay or something. There is molar tooth that is quite impacted, but it seems that the abscess, I think it's probably some collection of fluids, is right over here, but it's painful, it's swelling, so I think there is some fluid that maybe even enhance. But why is it? Where did it come from? It's so close to the tooth that I must say that I think that there is some, I don't know, a root decay or something. But I don't see it. But it comes just from here. Maybe there is some radial cyst that I don't see here that got infected from tooth decay of this tooth. There is something. Okay. Absence of mandible, we know, with a well-defined area of collection noted in the soft tissue on the left side, as probably I think I found it. So what is it? Gorham disease mandible, a case of Gorham disease involving the mandible. Massive osteolysis of the mandible with lack of compensatory osteoblastic activity, replaced by a fibrous tissue usually associated with angiomatous swelling. So it's not an abscess. In this case, the swelling was due to inflammatory change proved by an FNA. What is FNAC? FNA core? I don't know. This disease most commonly involves the scourge of shoulder, rib cage, and pelvis. What is going on? This is Gorham disease. Gorham disease, also known as Gorham-style disease or vanishing bone disease, is a poorly understood rare skeletal condition which manifests with massive progressive osteolysis along with the proliferation of a thin-walled vascular channels. The disease starts in one bone but may spread to involve adjacent bony and soft tissue structures. Signs and symptoms are incredibly varied depending on the bones involved and may only become apparent after a fracture. The etiology of Gorham disease is not well understood but may cause many cases may be due to somatic mutation affecting the RAS, MAPK, and PI3K pathways. As such, some cases may be considered mosaic rasopathies. The study is thought to be due to an increased number of stimulated osteoclasts, which is likely secondary to abundant non-neoplastic vascular and lymphatic proliferation in the affected region. Maybe this proliferation of vascular and lymphatic vessels caused this collection. Why there was a collection? The bone is subsequently replaced by a variable amount of fibrous connective tissue that is hypervascular. I think that the hypervascularity make this area prone to collection, to fluid collections. Gram disease can potentially affect any bone, including the mandible that we just saw. Splenic cyst and soft tissue involvement underlying skeletal disease represent characteristics extraskeletal manifestations supporting the diagnosis. So on plain radiograph and CT, we see intramedullary and subcortical lucent foci may be the earliest manifestation. This progress to profound osteolysis. So osteolysis is probably that there is no bone. So if I ask him osteolysis meaning, I think that the bone is getting lost. Pathological destruction or resorption of a bone tissue, as we saw, the mandible was lost with resorption of affected bone, as we saw the mandible, and lack of compensatory osteoblastic activity or periosteal reaction. Therapeutic options from Gorham disease include pharmacological treatment followed by radiotherapy and resection arthroplasty. And there is a differential generalized lymphatic anomaly, osteolytic metastasis, osteolytic primary bone lesion, multiple myeloma with its lytic lesion, osteomyelitis, which is infectious disease. The patient should be with high fever usually, rapidly progressive osteoarthritis, usually probably older, and multicentric carpal tunnel osteolysis and Charcot joint. This joint is probably in diabetic patients, so it's neuropathic and it's probably diabetic patients. Diabetic mellitus is the most common cause of gyro joints, as we know. And multicentric carpal and Milwaukee shoulder. I don't know what it is. So this was a case of Gorham disease, and I don't believe it that I just missed a total no mandible, and I even didn't see it. And this is quite right. This is quite okay, probably. I saw the impacted molar tooth, but I didn't saw there is no mandible. No mandible, for God's sake. Okay, thank you very much. And here is just a collection of fluid, probably because it's hypervascular, part of Gorham syndrome, Gorham's disease. Thank you very much. If there are any mistakes or corrections, please tell me. Thank you. And thanks for Edupedia for all of this. And thank you all. If there are any mistakes or corrections, please tell me. Quite nice. Let's say Gorham is probably rare, but we did go throughout some anatomy and some findings and some practice. Thank you very much. And this was about Gorham disease from thanks to Radiopedia. I'm not from Radiopedia, but thanks for them. Thank you all, and that's it.